everybody, welcome to Psychedelics today. I'm in conversation with Floris. Floris Wolswijk is a coach in the Netherlands. He is famous for Blossom, and I'm really happy that we get to have this chat. Floris, how are you doing today?
Hey, David, doing great. Yeah, we just had a lovely summer here. Been working in the garden and then coaching, working online. Just be keeping myself busy as always.
Awesome. Awesome. Yeah, I remember you mentioning on an email that I think do you have chickens as well?
Yeah, that's correct. We moved out of the city about a year ago, and now, are living in the countryside. And I can't say I regret it.
Beautiful. Beautiful. And I remember we met at Breaking Convention. It was really good to see you in person. I remember on the dance floor, you're quite a tall chap, aren't you? How tall are you? I'm only 5'8". I'm content with that. Mild insecurity, but it's okay.
It's 194 centimeters. I think it's 6'4" or six something.
Oh wow, awesome. Yeah, that is tall.
Yeah, and I guess we as Dutch are sort of famous for it.
Yeah, bicycles, dams, being tall, and yeah, cannabis and, and psychedelics, which we're going to talk
Yeah,
a lot about. Are you born and bred in the Netherlands?
yeah. Born in Arnhem in the east of the Netherlands, really near close by the German border, and then started studying psychology in Rotterdam. Stayed there for about 15 years, and now an hour north of Amsterdam.
Awesome. All right. Well, yeah, I haven't been over there for many, many years. I'm hoping to come for the next ICPR. Uh, just before we jump in to our actual conversation, can you tell folks a wee bit about you? Because you haven't been on our show before, Flora. So yeah, just tell us like a bit about your life, the genesis of your being, and how psychedelics kind of came into, yeah, part of your professional practice and why it means so much to you.
Yeah, as you just mentioned, I studied psychology, but I guess that wasn't really the genesis of me working with psychedelics at that time, and maybe even still today. There wasn't much or even anything about psychedelics mentioned. Like you started with Freud, Jung, sort of you had some things that maybe were related to psychedelics, but the word psychedelic wasn't ever mentioned. Whilst we have maybe 2,000, 3,000 articles that were published around that time. So it kind of got, I think the word is memory hold for a while. I started doing psychedelics at around the end of my studies. Psilocybin containing truffles are fully legal here in the Netherlands, but also experimenting with MDMA and other psychedelics. And I started a company after studying psychology that had nothing to do with it. It's selling complete meals, a food supplement online. But after a few years, I really got the itch to I wanted to do more with my studies. Really see how can I do more with people in person. Also, I was just doing everything online. We had a small team in person, but your customers are online. You're just chatting with them. It's really more abstract. So I wanted to see can I, within the Dutch framework of being able to use psilocybin containing truffles, do coaching with psychedelics. So that's kind of where it all originated. Together with a friend who's a lecturer at the University of Amsterdam, we wanted to see can we have that experience that we're having ourselves? Can we give that to others? Can we prepare them for psychedelics? Can we have a container where they feel comfortable, where they are able to explore ideas, to be in a more flexible state, and also provide guidance afterwards. We started this in 2019, of course, then or September 2019, and then a few months later, COVID hit. So the coaching has been on and off for the last 5 years. And for the coaching, I want to know like what is that psychedelic research what that I haven't read about during my studies. So I started diving in, and I knew how to make a website from my previous enterprise. So I was like, just put it online. There may be like 200 research articles. I'll categorize them. Say this is about psilocybin. This is a double-blind study. This is by this researcher and that researcher. One thing led to another, and now 5 years later, the database is clocking in at over 2,100 research articles. So they all are categorized: who's the author, what's it about. They have a summary available. So yeah, that's really really grown over the last few years. So it's sort of a passion project that's became my main thing for quite a while. Next to covering the research, Blossom covers the companies a little bit, the people working in psychedelics, but for instance also the courses. So the courses Psychedelics Today has, but also others, sort of mapping out what is there, what is available, how can people learn more about psychedelics. All with the idea of saying how can we both study psychedelics, but also how do we make it available? And I think that's what's changed for me over the last 2.5 years. And I started working with Leah Mix at Delphi, who's been a recent guest on the podcast, seeing how can we implement psychedelics? How do we make this something that's available to more people, both within the medical frame, but also outside of it? So yeah, I've really been sort of a disseminator of the research. Been working with Lucid News, some articles around sort of what is it that we can say around the research. Working with ICPR on the conference, and also 2 years ago led the day on sort of the implementation, like how do you bring this into practice, and help them this year again with the conference. Sort of bringing those things together. So yeah, it's a combination of different things that interest me, where I have something to add. I think all through a bit of a lens of how can I add sort of to how can I make the lives of others better. Before I became a psychedelic enthusiast, I was heavily somewhat involved in the effective altruism community. So I led a local group in Rotterdam where I used to live. And they're really thinking about how can you have the most impact, both maybe by donating money, but also with your career. I think that's a big part of it. And then where I sort of have a good, comfortable life, as you said, like with the chickens here, there's 2 dogs, like everything, it generally is good. So how can I use the skills I have, the resources I have to help improve the lives of others? I think that's sort of a underlying motivation between it all, between coaching 101, spreading this information, doing the consultancy. That's sort of the red line that's going through all of it.
Beautiful. Yeah, I don't know if it's a red line, but there's a line there that I think doesn't get enough attention in the space, or in how the industry is scaling around how useful is this, or how is this going to help people? How relevant is this to real world situation? And so I love that what you're doing there. Like, in a sense, a lot of research I think is sometimes just to fill journals, or to make people seem great, to get investment money. But there's a real piece here around actually, research has a role to play around accessibility, or being able to kind of prove efficacy, about knowing what does work and how to develop the infrastructure and the models of care and the best practices that's going to help the most people kind of bang for your buck. So I love that you're doing that. And then you're doing this coaching work, like real world, actually helping people, that are using psychedelics. So, quick question. When you started Blossom, it was, the psychedelic renaissance, resurgence, whatever you want to call it, had already started. But the uptick has exponentially grown. So I'm just wondering, like, did you have any idea what you were getting yourself in for when you were saying, okay, I'm going to find the research and summarize it and aggregate it and just help people, like, internalize what's coming down the pipeline? Did you know it was going to be like just such a massive increase exponentially of research coming out each month?
No, I didn't do it because it was easy, but because I thought it was going to be easy. I think that's a saying. No, when I started, I had a weekly newsletter, The Bloom, that's still ongoing, and in the newsletter I could cover the latest research, what was happening with companies, what was a news article around psychedelics, like everything just fit into maybe 5 different bullet points that covered it all. Like sometimes there was a week where there was like no substantial research, maybe a review came out, but nothing else. Now I think there have been months where I've been adding a research article to the database every single day. So 30 articles that been added that is a new experiment, like a new study that's really adding to the literature. And sometimes, of course, it's a small thing, but yeah, it's really grown. I mean, one way to conceptualize that is that when I started, there were two psychedelic research centers, so Imperial College London and Johns Hopkins University. Those were the two named psychedelic research centers. And of course, at that time, there was already research happening at other places. And for instance, still, I think Maastricht University doesn't have a psychedelic research group with a psychedelic in the name. But of course, the research was happening already. But now there's over 20 and maybe even over 30 named psychedelic research groups. Sometimes it's just a name and one person there, but in a lot of cases, it's a research group with 3, 5, maybe more people dedicated to looking at psychedelics and how they can be used, both therapeutically, but also looking at how do they work and what can we learn from that.
Amazing. I think I want to ask you a very basic question about why is there so much research happening lately? Why is there a proliferation? Ultimately, like, what do you feel like the underlying causes of this are?
Yeah, I would say it's twofold, or maybe there are even more motivations. But the one hand, it's so something so interesting is happening with people when they're under the influence of psychedelics, that so much changes in the brain that researchers want to learn more about what is happening and why is it happening. Can we learn things about consciousness? Sort of the big open questions that we have. Are psychedelics something that can help with that? And on the end, it's the therapeutic effects, where you can see that people that have been stuck with PTSD for over 15 years, that then really feel better afterwards and don't have that indication anymore. I think a large driver of the funding for the research, of seeing which psychedelic can help with what, and really driving the exploration in that way. So I think that's the sort of the therapeutic potential thing that's driving a lot. I think in terms also of the funding, of seeing, like, is there a new paradigm that's possible in medical care and care for mental health disorders. I think that's where the large promise is for people.
Yeah, I really appreciate the first point you made around psychedelics giving researchers, in a sense, a ingredient that enables them to understand maybe consciousness more, or the human being more, regardless of whether they have a disease or a condition to treat, regardless of whether you have a medicine to medicalize, that they simply enable us to, in a sense, have a magnifying glass into consciousness itself, which we really don't know much about. So it's a very kind of effective catalyzing tool to understand us.
Hmm. Yeah, and then maybe it's a good shout out to do for the QRI, which is a research group that's working together with universities, but they're a separate individual group, the Qualia Research Institute. And they are also really seeing how can we use psychedelics for that study of consciousness, and seeing what are the ways to explore that, and learn from psychedelics or from psychedelic experiences. Maybe another way of seeing why psychedelics are so powerful in that way is that, at least for maybe 95% of people who take psychedelics, like, something exciting, something will change. There's a small percentage of people who, for nothing happened. I just recently saw that maybe 5% of people who smoke DMT just like, nothing has happened. Everything's still normal. So of course, also super interesting to learn why that happens. And I think there's even a case study of someone who then did nothing acutely happen, but her depression did go away. So then that's of course still also interesting to look at. But in other modalities, for talk therapy, for meditation, a lot needs to happen. There's a lot of effort or a lot of time that goes between starting and seeing real large changes. And psychedelics, something happens within minutes, within an hour, and with a lot of times lasting effects that if someone does feel better for 6 months, for 12 months, some studies looking at 5 years later.
Yeah, that's a really good point about the rapidity of effect, and in a sense that helps to prove that there is causality there. Yeah, that's really interesting. I also want to understand the benefit of research for changing people's minds. It could be politicians, regulators, the scientific community, and also just general people, folks that maybe have stigma towards psychedelics or towards mental health in general. And maybe as a question for you, Floris, we can talk more about that generally, but I'm really interested about life in the Netherlands and what some of the assumptions, the norms, the stigma is around psychedelic drugs there. And how does that affect regulation? How does that affect science and innovation and research there? Because there's I think a bilateral feedback loop between kind of public attitudes and stigma and normalization and innovation and research and policy. So perhaps just talking about the Netherlands, what are you seeing there around the relationships between those things?
There's a positive side and a stagnant side, I would say. So we're the world leaders, maybe 20, 30 years ago on cannabis, right? Like when it's in we call it a coffee shop, but where people sell cannabis and cannabis products, when it's there, it's legal. And but how does it get there? Who's producing it? No one wants to know, or at least the politicians don't want to know. Like it's legal when it's at the door or in the shop. And in a way that's trying to keep all the different parties happy and to I think it has worked for the Netherlands. Of course, there's maybe issues with tourism going to Amsterdam or to Maastricht coming from other countries and the issues involved with that. But generally, it's worked well. What I see, I think, in terms of people using psychedelics or even using cannabis, there's less stigma around it. You can legitimately buy it in the shop. It comes in a normal packaging. During broad daylight, you can buy it. It's available to people old and young. So I think in that way, it's a good model to have, that the people who are using psychedelics, who are using cannabis, they don't feel stigmatized for it, and they feel comfortable doing it and comfortable asking questions. If you go into a coffee shop in the Netherlands, or if you go into a smart shop where they sell psilocybin containing truffles, you can just ask advice and someone will guide you and say, do this, do that, start with a half dose. So there is a good container around it of how people are using it. And I guess in the Netherlands, we call it polderen, which kind of means keeping everyone happy, to have all the, also in our politics, we have always a coalition of maybe 4 or 5 different parties. And where, for instance, you see at the Amsterdam Dance event that they're not criminalizing the users of psychedelics or other drugs. Like if you have a amount that is for personal consumption, you get maybe a stern talking to if you have it out on the streets, but people aren't being randomly search for it on the street if you're a normal consumer. And even at festivals, like people are being checked at the front door. But I think, and this is more of a sort of how I feel about it, I haven't checked, but they're checking if people don't come in bringing knives or other large things, or bringing like loads of drugs in. If people have some drugs on their body, they're not patting you down as if you're going entering a prison. So I think it's more of a maybe live and not live and harm reduction attitude. So they're at festivals. So a friend of mine, she's working on like psychedelic care of people who are having a challenging experience, that they have a place to go, that they're not being judged, that they're not per se immediately being looked at through a medical lens, but more through a compassionate lens. And doing it that way, like the police or the whole attitude around Amsterdam Dance Event, which is a huge undertaking, like maybe a week long or 10-day long festival all throughout Amsterdam. There, just information around hydrating enough. There's information maybe if there's a drug going around that's contaminated. The drugs that are in the supply are being monitored. So in that way, it's looking at how can we help and how can we protect the consumer. So I think in that way that is still progressive and still like a great way of doing this. On the other hand, it's the policy has stood still here in the Netherlands. Like, there hasn't been a sort of positive change. There's now some money for research available, so in that way things are moving along. And I think the Netherlands is relatively famous for the research that is happening here. Also in terms of maybe even next to the universities, commercial research where people do phase 1 studies here in Leiden in the Netherlands. So in that way, a lot has happened. But in terms of politics, it's always been center right, and now it's a bit more to the far right in terms of the government. So we're not expecting anything to change or people to work towards real legalization, and maybe even people or the whole supply chain being approved or taxed by the government. Which maybe some people do hope for. The mayor of Amsterdam, she's looking into this and seeing like, can we propose that? Because the one hand, we as consumers, it's a relatively safe and comfortable. You don't feel like you're in danger from the police when you're doing psychedelics or other drugs. But at the same time, we're a drug producing country. I don't know what the exact number is, but a large percentage of the ecstasy supply does come from the Netherlands. And there's still a lot of crime and things happening around drugs that maybe we don't want. And so there's a lot of different sides to the story. So generally we're doing relatively okay, but there hasn't been large changes which you might hope for.
Yeah, thanks for all those nuanced answers. It's definitely important not to romanticize it. And ultimately, there's still not a medical model there. It doesn't exist yet. That's in the pipeline. So we'll come back to that later. Let's start talking about research, and if there's any really broad trends that you notice, having looked at these 2,000 something papers, like if we were going to aggregate all of that data, all of those causalities and conclusions and outcomes, what might be a couple of the things that we can definitely say are true? Not necessarily about every single research study, but what are some of the most common observations that we could make if we were going to aggregate all of those research studies about what is so effective and special about psychedelic assisted therapy, and why exactly does it work?
Oh, that's a very good broad question. I would say that we see that psychedelics work for a variety of mental health disorders. And even saying mental health disorders is sort of the traditional framing maybe, but we see that it works across a lot of different indications or different things where people struggle with. So I think there we can think quite confidently say there's sort of the underlying mechanisms of psychedelics, and I guess I'm referring here to classical psychedelics like LSD or psilocybin, in how they work and how they sort of can make the brain or your experience or your look in life more flexible. I guess neuroplasticity is a term we can throw around here too. But really can say that people can look through another lens at where they are and sort of step outside of the frame where they've been stuck in. If it's maybe a frame that's stuck in looking forwards or looking backwards, but getting more flexibility there. I think that's sort of a key component that we can confidently say. I think what we can also say is that with psychedelic experiences, and this is more versus traditional medications, it's something that works immediately. I think there we can include MDMA and ketamine too. We can see there are effects within minutes, within hours. And it's something that has lasting effects. So when the psychedelic is outside, is processed by the body, it's fully out there, there's still changes happening. So people's brains are generally, say, 2, maybe 4 weeks later, still in a more flexible state. But also 6 months, 12 months, even years later, you see lasting effects. And I think there we're still figuring out like what are the different components, like what is important. Is it really the therapeutic container? Is it what's happening during the session or more the preparation around it? what is really causing that, and how can we do that in an effective way that people are being helped, that is something that the healthcare system can cover. But yeah, seeing how can we have those long lasting effects, and how can we do our best to support that. And I guess if we look over these last 5 years, and as you said, like there's been a meteoric rise in the number of studies that are being published. We get a better and better understanding of the different indications and different drugs and how they work. Before we started recording, we also talked a bit about, like, or as I saw you mentioning, like, do we need to have new psychedelics? Do we need to invent new molecules for treating things? And I would say yes and no. On the one hand, like, we're still in those final stages in the phase 3 studies with different psychedelics on how do we can we even test them in this large scale and really confirm the results we're seeing in smaller studies. But still, there may be some parts of psychedelics that we can improve on, maybe to fit better with the medical system, and them still being effective, them still giving a long-lasting effect, which we have to find out. So, say, changing the psilocybin molecule slightly, so it's a shorter duration trip, or maybe extending the DMT trip, so it's a more gradual thing, or it's a more steady thing versus just a really quick peak. Or making MDMA safer, so it's less taxing on the heart. Where it's something that maybe us as guys who are fit and healthy, hopefully, like we can take. It doesn't matter if our heart rate goes up a bit and the blood pressure does, but if we want to make this available to a really wide audience, I think and hopefully we can talk about this more, but why I still believe in the need for medicalization is to make it available to people who maybe are less fit, less healthy, and to make something that is safe for them to use. So both in terms of safety and maybe efficacy, but I don't think we have strong signals around novel molecules being way more effective. I think that's our ways that we can improve on that, and we see some first studies on novel molecules coming out.
Beautiful. Thank you for that. Yeah, I can be a bit cynical sometimes about research, and I guess some of that is around how objectively true is the research, and but also around the commercialization of and medicalization of psychedelic therapy. But what you're saying is very valid, because some of those molecules can be improved upon so that it is easier to introduce to a medical system, so that yes, there can be a better safety profile, fewer contraindications. In a sense, maybe it gives people more choice as well. So they could go down a more recreational, personal use or entheogenic model, and here's what's available, or they could go down this clinical medical model, and here's the molecules or the compounds that are available and the protocols to go with them. I think it's another question around research itself, Floris. What would you say are some of the biggest, I think, sticking points, problems, challenges in how to do psychedelic research? And it comes up a lot lately, particularly around Lycos, double blinding and placebo, and to what extent psychotherapy can be measured and combined with a psychedelic medicine. Those are at least 3 of the things I'm aware of. So how is the research community grappling with some of the critiques and challenges of doing psychedelic therapy, especially in conjunction with psychotherapy?
Yeah, I think you covered the largest challenges, or the biggest challenge that we see. Although I would say that they aren't unique to psychedelics, right? Like, placebo control is something that comes up both in other medical interventions. Say there's like famous studies on doing knee operations, and then doing that sort of with just opening someone up and not doing an actual operation, and just cutting them or stitching them up again, and then you see sort of large placebo effects there too. So a lot of it isn't unique to psychedelics, but it might be put under the looking glass and sort of become something that's more prescient. And think there we now see, and that's things that what's Ingmar's last name from Fluence?
Gorman. Yeah, Igmar Gorman.
Gorman. So that's something that Ingmar Gorman from Fluence has also discussed on the podcast recently. That there are things within psychedelics that become more prescient, but yeah, also happen outside of it. So I was no okay. Let me just go back 1 second. Yeah, yeah. It's something that Ingmar Gorman has also discussed on the podcast recently around Lycos and the trial design and things that need to happen there. I think if I can sort of add something to it, or how I look at it, is that it's a huge learning experience for the research community, but also for the companies that are commercializing psychedelics and looking how can we turn them into medicines. So I think there they can now see what are things that maybe even the FDA didn't see, right? Like the FDA had a SPA, sort of a protocol to design the studies together with MAPS to say this is the phase 3 study and this is how we're looking at it and this is how we designed it together. But then, yeah, they're learning more things now, and then the outcome, the people there, they weren't involved in designing that, or maybe even people within FDA that were now looking at the data were like, well, but we didn't think of how to do this, or we're seeing new things there. So I think it's a huge learning that other companies out now. So yeah, I think publicly saying like, oh, we're gonna change this or we're gonna do this differently. Because I think also, yeah, if you're Lycos or previously Maps, if you're thinking about MDMA and then someone having a great experience and really being happy, which I think happens less during MDMA assisted therapy than people at a festival or at home at a party and having a joyful, ecstatic experience. But still, that's yeah, you don't. I would say like if you're naive or if the FDA hasn't said this before, adverse events don't mean that, right? That's not what you're thinking about immediately, but it is what the FDA now wants to know, and they're seeing this as an adverse event in terms of something you're not expecting to happen. So that's sort of more the definition, but also in terms of people wanting to do psychedelics outside of the trial and people doing it afterwards. And then again, you can say maybe I can represent sort of a normal person listening to this. Like there's maybe 2 million people doing psychedelics every year. Then people within a research study or people within the medical model. Then yeah, adding 10 people to that's not gonna tip the scales. But still, from their perspective, from the FDA, who is normally looking at a drug that isn't in the general population, I think, yeah, they still want to have that information. So the other drug developers and Lycos, of course, themselves are now taking that to heart and seeing like, what are the things we have to look at. And then for placebo, there's a lot of studies coming out and seeing like how can we parse this. And it's seeing, do we, and then also for Lycos, do we need to have a arm with a relatively small dose of a psychedelic? I think that's something more maybe for Rick Dublin to answer. I know you're going to speak to him soon on the podcast. Seeing like what were their motivations, or how does he look at using a low dose of MDMA? I think they had this in one of the phase 2 studies, and they saw that the people who gotten a low dose of MDMA, sort of their anxiety or something, the fact that did happen, but they didn't have a therapeutic effect. So they saw actually they were doing worse than the placebo group, because they're like, oh, something is happening, but it isn't the real thing, or there were expectations. So I think it's interesting to hear why they didn't choose to include it in this study. And yeah, I think you do need to have this in the phase 3 studies too, is to have a 0 or 1 milligram psilocybin, maybe 10 and then 25. I think that's what Compass is doing right now, willing to be able to at least a bit better parse out the difference. But yeah, maybe that also sort of tunes into another part where psychedelic research is different from a lot of other research. It's just that the expense of running the trials is just really high. So there's a lot of cost on the one side, because you need to have a lot of therapy, or at least most drug developers opt to have therapy, or some call it psychological support, but still have a lot of hours around it. then the study drug, and so it's a huge undertaking versus a lot of other medications that are more, there's less involved per patient. And then on the other side, the problems might be smaller, right? Like, if we dose people 1, 2, 3 times, and maybe half or more of the cost that's involved is therapist hours, how does a drug developer get a return on investment? I think that's still a difficult question to answer right now.
Yeah, it's so complicated, especially when you're thinking that the revenue generated from therapists probably doesn't go to, or only a small chunk of that will go to the drug development company, if any. And there's so many hours of that needed. And yeah, some drug development companies are, in a sense, building out, so cancelling the therapy part. It's not part of their protocol. They're trying to just focus on the purely kind of neuroplastic effect of the medicine, and there could be benefits of that, particularly around therapy itself. Do we know that it's helpful? Do we know that it's essential? Like, do we yet have this proven, the data, saying that yes, in conjunction with psychotherapy, psychedelics are more powerful, beneficial, has more efficacy than just psychedelics alone?
I think we still want to study this more, and to see maybe also, like, what's the dose of therapy that's effective, and even the form of therapy, right? Because there's a still think a lot of questions around what type of therapy is effective, or how much that even matters, right? I think if we look at research on therapy, then therapeutic alliance is one of the key factors. I think even if it's even been studied in the MDMA phase 3 trial of sort of what the impact of therapeutic alliance was, and you always see that that's important, maybe even versus what type of therapy you're using. But again, within psychedelics, you can maybe say that some types of therapy might work better than others, or maybe also which ones are safer than others. Like, if you really have a somatic therapy and you have a patient that's in an other state of consciousness, that might be more challenging to scale up and to really have be done safely. Can you do psychedelics without therapy, or with like minimal support? I think we'll find out in some years. You see from the Compass studies that their effect size and the number of people that were without depression at the end of the studies is lower than in some of the earlier studies, where there might have been more therapy, or there has been more therapy. But is that because they're doing a larger study? So because they have 230 patients, which no one had ever done before. So the effect kind of wanes because of that, and because there's more the therapists involved that don't have those years of experience. I think that's still difficult to parse out. But yeah, I think it's generally safe to say that there's a part of the experience, and part of the healing is coming from the people themselves, and the part is coming from the therapist, and sort of them preparing the patient, and them doing the integration. But maybe another question that we don't think have good answer for, like, how much does that need to come from the psychedelic assisted therapy that might be on offer in some years, that's being assured? Like, can we maybe, and this is a hypothesis, can it be that Compass model where someone from the drug company, they do prepare people, they tell them about the psychedelic effects, they have some guidance around it, but someone is seeing a I would say normal, like a therapist that isn't involved with the study or with the implementation, and they are with that person, and they come back to the person, right? Maybe that's also a way of looking at it. So I think there's different possibilities to look at, and one of the critiques that Lycos has gotten is that they are now also the trainers of people who are administering the therapy during the study, and they're independent raters who look at, are they really, like, sticking to the protocol? Are they asking the right question? Are they are, that is in a way objective, but maybe later in the implementation, when there isn't a research study going on, is there someone else that could do that training? I think that's also a big part, or an important question, where we yeah, at the moment don't have a good answer for to see that it's being done more independently.
All really good points. Yeah, and I think the rating of the fidelity to the protocol is a big thing for clinical trials, but also in the real world. Like, yeah, that training aspect, that standards piece, and I think we'll see so many different protocols and triage systems set up in 5-10 years for people that go down the medical route to use different compounds for different conditions with different therapeutic protocols, group models, one to one, how much preparation, how much integration. There's going to be, real a menu of triaged protocols and, in a sense, patient experiences that folks will go through, but we just haven't built it out yet. And that's going to be partially about kind of cost benefit, the economics of it, and yeah, the patient experience and just the matching of the needs. And so, I was having a chat with someone recently who works with the VA in America, the Veterans Administration, and Spravato is approved, for VAs because it's FDA approved on label for depression. But like IV, IM ketamine isn't because it's being used off label. Spravato doesn't have any psychotherapy in its protocol. It's just purely the nasal spray. That's all they do. And for them to try and bring in a psychotherapy within the VA for Spravato or for IVIM, you can't do that because there's no evidence base. There's no proven data around what's the best one, what's the safest one, what's the right one, what's the protocol for that. There's no REM strategy for bringing in psychotherapy that's evidence-based. CBT's got a great amount of data, so it is, but not in relation to psychedelics. And I know internal family systems is very popular, and I'm a huge fan of it. And they are actually trying right now to become established as an evidence-based practice so that it can be used for insurance companies' reimbursement. And I would assume for Veterans Administration, EMDR has also got great data, but it's not quite yet at that level that it can be used, and it's particularly for trauma. So in a sense, there's a lot of research that needs to be done around psychotherapy models and what is most effective, what is most cost effective as well. And I don't know if any particular research that you're seeing around the psychotherapy piece to prove in a sense what is evidence based, what is gold standard.
Yeah, so there's research happening on seeing how do psychedelics work and how much do they work, but parsing that out and seeing what part of it is psychotherapy and what part of it is the drug. I think that's still in the early stages. I think if you're talking about the VA or sort of other health systems, like what can or can't they insure, I think that's the challenge of the current system, that there needs to be a motivation to research a psychedelic or psychedelic and drug combination to then sort of have that evidence you can present to get it insured. And that's, I think with Spravato, it's a great example that as far as I can see in the research, the effectiveness is similar to IM or IV ketamine, racemic ketamine, just the sort of the both parts of the molecule versus just S-ketamine. So there, yeah, from a bit of an outside perspective, you would say it's the same in terms of effectiveness of the drug, and then it's way more expensive, at least for the drug itself, to administer esketamine. I would say it's comparing like maybe $5 versus 5,000 for the treatment, which is a 2 orders of magnitude. So that's yeah, really challenging. But there is no one who's gonna, or there's Awaken is still doing a study on ketamine for depression. So they might come out with that. But yeah, there is less incentive to do that study to really prove that out, and it's challenging, right? Like for Johnson and Johnson, they did the studies on Spravato, and like as I think that's maybe also something that's different within psychedelics. It's all relatively young companies, or that they're still learning about and navigating the system. Like they did this in maybe, I don't know, like say 3 to 5 years. They really went from like, yeah, starting the phase threes and then having everything approved. But they did quite a lot of studies, and they sort of presented the best evidence they had, which is, yeah, standard practice for the medical field. But there, yeah, they had hundreds of people in those studies that, yeah, we don't see that ramping up that quickly and being done at such a scale within the rest of the psychedelic field. I think Josh from Psychedelic Alpha has some of like super interesting like visualizations on this, that you see sort of the psychedelic industry, and then you hear like it's a few $billion in terms of market cap or how much money has been invested, and we're like, wow, that's that. As an individual, we're like, wow, that's tons of money, and that's amazing. But then if you look at the market cap of drug developers, it's in the tens and in the hundreds of billions of dollars. So in that way, we're still a small nascent industry where, and I'm going a bit of a tangent now, but like you see the first signals of drug developers. Otsuka is a Japanese conglomerate. Like you see the first signals of them becoming more and more interested. And then for all yeah, the harm or the negative attitude that people have around drug companies, that they do have that efficiency, and they do have that knowledge, institutional knowledge to get drugs through the whole approval process. So yeah, there's positive and negative sides to it, but yeah, there might be chances that they can also do something good with psychedelics.
Hmm. You just mentioned Josh Hardman and Psychedelic Alpha, so I think it's a good time to tell people about the bullseye graphic that he did. And when
Mm.
I literally was probably salivating when I saw this, because it's a work of
Yeah.
art. There's just so much data there. There's so many different interpretations and trends you can pull apart there. So definitely, if you want to go check it out, folks, it's Psychedelic Alpha, and there's a bullseye for the last couple of years looking at the psychedelic industry around the drug development pipeline and what stages of the FDA clinical trial pathway they're at, kind of preclinical, phase 1, 2, 3, and then each tranche, slice of this bullseye circle gives a condensed view of all the companies and their drugs, molecules that are psilocybin, all those that are MDMA, all those that are ketamine, and then you can see that at the preclinical level, wow, there's so many that are coming down the pipeline that are novel chemical entities. So kind of they're creating these molecules and getting all the IP over it, whereas those that are at phase 2, there's so many that are psilocybin-based, compounds. And yeah, you can see the different conditions that they're there to treat, how many at phase 3 and how many are past. It's just Spravato right now, and Lycos is still hovering just about, in the phase 3 piece. Compass Pathways is coming through. So it's a beautiful graphic. Definitely, from a somatic perspective, how do you feel when you look at this? And more from a rational, interpretive perspective, what does that bullseye say to you around the state of the industry? What are some of the trends and patterns that you're noticing there, Floris?
Yeah, I would say so. Hopeful is the first word that comes to mind. There's so much happening. So there's a lot of different angles and different companies with different philosophies working on different psychedelics for a variety of indications. So there's so much potential out there. And yeah, as you'll navigate to the bullseye, like you'll see a lot of it is in preclinical and phase 1, and not so much in phase 3 and phase 3. So it's in a way that yeah, still a lot of it is in early days. And yeah, then if you're less hopeful, you'll know maybe from drug development that a lot won't make it, right. You won't see the effect that people were hoping for. Companies don't get the funding they need. um, I know one company, or maybe like two or three, are looking at traumatic brain injury, and it's yeah, they think one of them really has the funding now to go through, but yeah, the other companies just didn't get enough funding to sort of proceed to the next phase of research. Um, and overall, looking at that, or looking at the research, you just see the wide variety of places where psychedelics have potential, and it's things with to do with mental health, but also sort of broader, like yeah, say brain health, so traumatic brain injury, but also headache disorders like chronic cluster headaches, where we see really positive signals. And that's also maybe we're talking a lot about the therapy part of it. Like maybe there, it we don't even have to think about that part. It's just purely the drug that's doing something to alleviate or maybe interrupt and stop a cluster headache. So that's it. We still don't have large studies for that, but we see a lot of promise also in other areas. If you look at different psychedelics that are being studied, then maybe what's changed over the last say 2 years is that more and more has been going on with 5-MeO DMT, and seeing how can that be therapeutic. And you really see, yeah, maybe it's like 80% of like, and these are studies maybe with 10, 20 people, of people, yeah, being cured from their depression, at least in a few weeks or maybe even 12 weeks after the conclusion of the study. So this is a really, like, yeah, a big effect size. Uh, so yeah, you see more and more research happening there, and then yeah, maybe on the edges of the bullseye, you'll see more of those novel molecules, right? So those are in those early phases. So, you know, can those be developed, and can they be an alternative to, yeah, the psychedelics that we all know and maybe love.
Hmm. Amazing, yeah. And that 5-MeO study, is that the Beckley Psytech study?
Yeah, that's the I think the most well known.
Great. Just before we say toodaloo to the research topic, are there any papers in particular that you are just obsessed with, that you really, really, that this is fascinating, or this is just really important, like this is a bit of a groundbreaking piece of research and everyone should know about this?
I would say a few papers, or sort of the research direction that Elliot Marseille is taking. And think he's been on the podcast at least
Yeah, a
once.
couple of months ago,
And
yeah.
he's looking at the health economics of psychedelics. So how can psychedelics become something that works within the medical model for which worked for insurance? So first, he did a lot of studies on Lykos's phase 3 trials. I think earlier, so in phase 2, like how much does it cost? And at the breaking convention where we met, like he had a presentation around this, and he said like the MDMA will cost a few $1,000s for a treatment for 2-3 doses. And the researchers just they flocked to him after his talk, and I'm like, what are you saying? Like, what is this? Like, it's something that I think within the research community, yeah, people don't know about in terms of like how much a drug will cost. And then if you look at Spravato, that's, yeah, maybe like a comparable number that they're looking at to recoup costs and to have money to do more research afterwards. I think that's part of what's surprising for researchers themselves, but also really looking at how can this be something that's effective for a health system, and where does it fit in. And I don't know how much we'll talk about it, but part of the work I do is with Delphi, where I help manage the different projects and see like how can we, yeah, make psychedelics into medicines. At least most of the work is focused on the medical side. So I think it's super important to look at how do psychedelics become something that is cost effective and who wants to pay for it. So you have insurance companies that maybe don't want to pay for it because it's a lot of cost in the first year, and if people switch after a year, or think generally after 1.5 years on average, do they actually want to pay for it? Because then they're sort of sponsoring the next company over, or is it something that Medicare and Medicaid can, yeah, really pay for? So he's doing super interesting research into that, and I published a paper last week with some colleagues on how many people would be eligible for this, and we got a lot of press coverage. And sort of the median estimate was around 5 million people with depression that might be eligible for psilocybin assisted therapy. So I think that, yeah, there's some really positive signals of it being something that a lot of people can use, and then seeing in what way is it something that's cost effective. And still, if we're saying $10,000-$20,000 for psilocybin or MDMA assisted therapy, it's a large number in a way, right? If you compare against people doing this recreationally, or doing this in a guided setting in Oregon or in the Netherlands, it's, yeah, it's a factor of 2-3 more than what you would be paying there, or what is it, maybe a factor of 100 times in versus recreational use. But if you look at other medical interventions, sort of the cost benefit, it is there. So from his studies of the Lycos data, you do see that I think around 3.5 years, you do see it becoming cost effective, and, yeah, being beneficial for the health system. And if you kind of just take one step outside of just looking at it through to the yeah, how much it will cost. You do also see that people after a psychedelic treatment versus antidepressants. So this was the a quite well publicized study by Imperial College London. They just looked at the long term effects. So seeing that those were more positive for people that went through the psilocybin treatment, but that's not only on sort of the metrics of the depression. So just not only looking at, but looking at how many resources people felt they had in their life, their happiness, sort of the engagement. So you see sort of on fulfillment, maybe is a word to capture everything. You see people scoring higher after the use of psychedelics. I think that's a thing that might never be really captured by the health system, but something that yeah, something that we can see people improve upon.
Yeah, that's really interesting because I saw it yesterday on LinkedIn. What's his name? I think is it Imperial. The Italian chap is a researcher,
Tommaso
Bar
Bar, I'm hopefully not butchering his
Thomas
last name.
Barbara something. He was posting about that. I think he did a bit of an analysis with that same data, and yeah, that study, the data they produced from that, it has been regurgitated again and again. It's proving to be, incredibly valuable for, extracting patterns and really understanding, particularly around thriving, human thriving, not just symptom reduction
Mhm.
or curing, but thriving and all these other kind of secondary outcome measures that are really important for us to give credibility to. It's not just preventing suicidality or anxiety and having scores for that. There's other aspects of why people use psychedelics, um, other than healing and curing or reducing symptoms. And maybe now is a nice kind of little jumping point, Floris. Let's talk about your coaching practice. But before then, I want to understand real world evidence a bit more. Like, if we can talk about, we've mentioned it already, but what it is, how would we define it, and where does this, data from real world evidence come from? Who's capturing it? What are some of the studies that are actually using that? And to what extent is it reliable and helpful for understanding the benefits or the potential opportunities with psychedelics? So let's just go into that real world scenario. And then, yeah, I'd like to hear more in a little while about your experience in the real world of working with real people in the Netherlands.
Yeah, and the sort of the medical system or the medical model, like where we maybe want to fit psychedelics in, it's yeah, it's not really conducive to the psychedelic experience. You have the Rick Strassman studies doing this in a sort of a hospital room, giving people a high dose of DMT, and they're trying to sort of make the best out of it. And sometimes, I think even in the book, he sometimes mentions sort of yeah, just noises from a hospital, right, that would sort of disturb someone's trip. Or if I've been to the therapy space in at the University of Groningen, where they're doing research on psilocybin for depression, and it yeah, it isn't a place where you would send someone to if you're like, oh, my friend, I want to give you a psychedelic experience, please go to this hospital. You don't even have to really imagine the specific room. Like they do have sort of some a picture of woods from the floor to the ceiling, but it just doesn't have the feeling. It's still a hospital bed where you're laying in. And I think that's where you want to look at how are people using psychedelics in the real world. I think two examples come to mind. It's looking at how are people doing ayahuasca. So how are they doing that in the real world, and what sort of are the effects from that? And also a lot of research that is happening here in the Netherlands. So Michiel van Elk is looking at how are retreat centers doing the preparation, how are they doing the guiding, what are the outcomes there, what do they do differently. Yeah, I think in general, like, what can we learn from how psychedelics are being used in that coaching or sometimes even therapeutic container that is outside of the medical field? What is it that people do there? Yeah, what are they doing in terms of groups, right? That's something that has barely been studied in more academic literature. And what are the benefits from that, or maybe what are some of the challenges there? I think there's a lot to learn from how people use psychedelics in the real world. And maybe even to go on a tangent there, I was just working with the Microdosing Institute here in the Netherlands, and they collaborated with the Maastricht University, I think in 2018, on some microdosing research. I think it's still a hotly contested area where we can say, like, yeah, a lot of really academic studies where they take one measurement of creativity, we don't really see that much change on, yeah, when people are microdosing, like, or even if they're taking a full dose, do they really become more creative on this small test of creativity? So they did this study looking at creativity in more of a real world setting. So people microdosing together, doing a workshop, and then doing some tests at the study and doing tests a bit later. And there you have some. You do see some effects of people, yeah, having changes in the. I think mostly in the divergent creativity. So sort of looking at how can you have more ideas. So how do you look at different areas, cover a wider area. Um, so yeah, I think even in that area, you see that how psychedelics are being used in the real world can be different from academia. But there's challenges with looking at how psychedelics, yeah, are used in a naturalistic setting. The dose of it can be difficult to measure. Sometimes they do measure it afterwards, so they take the ayahuasca brew and measure what the dose was, and to try to correct for maybe loss over the time it took to bring to the lab, and the same for psilocybin containing truffles. But there, yeah, you do see that there is a lot of variety or variability in the dosage of the drug you're using, and that's different from when you're in the lab and you really have an exact dose, and you have the setting that is relatively consistent, right? There might be again a therapeutic alliance that differs per person, per therapist that's there, but there's maybe more variability that makes it more difficult to study in the real world. But it has more, I think you would say, like ecological validity of like how are tens of thousands, hundreds of thousands of people using psychedelics in that more guided, facilitated setting.
Hmm. Yeah, and I'm just thinking about a couple of things. That one, there's a protocol that a lot of veterans use when they go to Mexico with ibogaine and then 5-MeO, and it seems to be a very good combination and protocol, very intense. But for a lot of veterans, what they've been through and where they've tried everything else, that has proven to be a very effective protocol. But no one's studying that in a randomized control trial, and yet probably hundreds, if not 1,000, people have been through that protocol now, particularly veterans. And there's also the research that Nolan Williams did. I'm not sure where his site was, but that was using a retreat center. It might have been in Mexico as well, where
Yeah.
the participants had ibogaine, but they didn't take the 5-MeO because they just wanted to isolate what the ibogaine had as an outcome for traumatic brain injury and then secondary depression, anxiety, PTSD. And again, not a randomized control trial per se, but it was standard dosing, and they took outcome measures at certain time points. That is, and the outcomes of that were really very, very significant. Like there was a significant effect size there, particularly around TBI. So that, if that was being done in a controlled trial, and it was then going to go, okay, great, let's bring that into the VA. Let's bring that into, sports and athletes that have, impacts and brain impact. So, it's frustrating in a sense that it's going to take so many years and investors to hopefully pick that up and go, oh, yeah, I think we can make money from that. Let's do that. Or will there be, another trial that has slightly more kind of rigorous protocols around it, and then some government or healthcare regulating agency can say, actually, we really need something like this. We're desperate to have a new treatment for TBI, maybe give it breakthrough therapy status, similar to what Kentucky and Ohio was looking at with ibogaine. They literally had a state of emergency around opioid addiction, so they entertained this. Let's just bring in ibogaine. Let's explore this, even though it's not FDA approved, even though it's a complex medication. So yeah, just around this piece, I guess, Floris, around some of these studies, like the Nolan Williams study with ibogaine and magnesium, how promising they are, and what to do with them to get them to the next stages of real world impact and helping real people, to access these treatments.
I think there are ways to sort of combine the best of both worlds to see how can we have that ecological validity and have that space be something that people go to. And I think those like retreat centers, and I don't know exactly for the study, but I think in general, like a lot of them are really well run, right? There is medical personnel there. It's a place where you would want to send a friend to and say this is a safe place to be, and it isn't a hospital and a sort of really clinical and sterile setting, but more where there is more care for the participants. And that you can still do some of the things you want to do in research, to maybe send some people there that do go to the yoga classes, that do get to talk to the facilitation team, but don't get the active drug. So I think there may be ways to combine, things from there with the medical setting. And at the same time, like, not even just looking at how can we do that directly, but also what are learnings from those retreat centers that's been doing it for 10, 20, maybe even longer. Like, can we learn things from them that you can then apply in a clinical trial that's maybe taking place in the US? Um, so I think there are ways to learn from naturalistic settings where people are using psychedelics, both in retreats or in clinics.
Yeah, and another piece that you're making me think of there, Floris, is around best practices from the underground, and retreat centers. Like, what do we already know from doing this for decades, but also hundreds and thousands of years, particularly on a kind of humanistic and relational level? What works, like particularly for space holding and helping people prepare, to go into this psychedelic experience. How to handle a challenging experience, spiritual emergence. What is ethical practice? So we're not starting from scratch here. Like, there's an actual history, there's a lineage in some respects, and there's communities of people that have been doing this for a long, long time. So I'm interested around the intersection of that with, this gold standard best practice, clinical practice guidelines that we are developing right now, and it's probably not going to be here for another 5 years, probably, I reckon, around about. So to what extent can what we know from the past be helpful, and how does that again translate into real world, commonly practiced and accepted guidelines?
Yeah, so instead of having tens or hundreds of people in a trial, some thousands of people going through the clinical trials that have been done already, you have hundreds of thousands of people, right? And people that have experience guiding maybe over 1,000 people with psychedelic experiences, and being able to learn from that and see what has worked and to be able to transfer that knowledge to others. I think that the intersection of sort of the ideal of science, or you said the clinical practice guidelines, is seeing how can we capture that information and make it something that's available to more people. That's something that we can teach to others to apply within, hopefully a medicalized, but even within sort of the coaching world itself. I think that's a question that people are now, yeah, that we're learning here in the Netherlands. We have a Guild of Guides, which is a small NGO dedicated to, for instance, those guidelines on what is it that people are doing, how do you do an intake, how do you do screening, um, really seeing how can we transfer that information from some people that have been doing it here for a few decades to maybe also next to the research. There's been an explosion in people that are doing facilitation with psychedelics, and is there a way to get them up to speed quickly? Is there training that can be offered? I think there we're still learning a lot of how we can do that. And there are some manuals out there of people who generously shared that with others, but still it's still a lot to learn, right? Like, my wife, she's been a therapist for over a decade, and she's now working with psychedelics for maybe the last 3 years, and it's just seeing new challenges that you don't see in normal day-to-day talk therapy, where yeah, people can have a challenging experience, and how do you deal with that? Like a part of it, it's yeah, I would say normal skills you learn through experience as a therapist, but part of it is unique to psychedelics, and I think we still want to keep on learning on how what is best to do there and how to deal with that. I think yeah, a large part of it is to. I think that's what you hear, at least from people who do psychedelics for the first time. It's normalizing what has just happened, or saying like, you're not unique and you're not broken, but it's something that can happen to others too, or has happened to others, or has happened to ourselves as people that are guiding them to have a challenging experience and to be able to learn from that. So yeah, there's a lot of normal therapy skills, but also a lot of things that are unique to psychedelics that yeah, still think can be codified way more than is being done currently. And think academia in sort of the rigor that sometimes yeah is associated with it can yeah add to that.
Mm, thank you. On the downhill straight now, about you personally, Floris, when you're reading hundreds of research papers for Blossom, when you're not doing this work with Delphi, when you're not working with ICPR, when you're not gathering the eggs from your chickens, you're seeing clients with flow coaching. And I'd love to hear more about that. So if you can talk through what kinds of people are you helping, and what are they coming to you for help with exactly? And yeah, is it are you working with your wife in the sessions, and how do you do preparation and integration as well? So just paint a little picture for us around your work with flow coaching.
Yeah, so next to my personal journey with psychedelics, like wanting to work with psychedelics and helping people with it is sort of the instigation of what eventually blossomed, I guess, into Blossom. Uh, I, I'm helping people that come in with coaching questions, and that's maybe the big differentiator versus what some other people are doing. And the biggest reason for doing that is like I've studied psychology and I have a bachelor's and a master's, but I've never been a therapist that's been doing this for 10, 20 years, that has access to other personnel within the medical system, or has access to people that can help people when they're in depth, or if there's something going on with their housing, like things you do. And my wife, she's until next week still working in at the family doctor, right? She can tap into that whole system and really help people that way. So we don't, at least from us, we don't feel it's responsible to help people who have a lot going on, who don't have the resources to maybe deal with a challenging experience, or need to have more help than we can offer within a coaching framework. So we really try to focus on people who come in with questions around, where do I want to take my life? Like, I'm at a crossroads, and what is my next step? Or I feel I want to process something from the past, but I'm not stuck with a sort of clinical indication of depression or like really acute anxiety. Of course, everyone has sort of something isn't like perfect, or I do feel anxious about something, right? Like you don't have to have like a perfect clean slate and be the happiest person on earth. But we really try and stay away from something that is medical, and that's maybe even another reason why I'm still so focused on medicalizing psychedelics, to make that available to a place where those resources are there. I know that there are other facilitators here in the Netherlands that do work with sort of a larger medical team that yeah, they can offer more support. What we do is we do 3 preparation sessions, and we do 3 integration sessions. So that's really active coaching, right? So yeah, you talk with someone. It's a lot, that's just mostly it's done online with a video call, and then the session itself is it's mostly facilitating. So people have psilocybin containing truffles, and there you really yeah, really make sure that container is there, so there's less active coaching, as you also see a lot in the psychedelic research. So really making sure someone's comfortable, and we can remind them of the things they want to work on. So do that in a more facilitative versus a coaching role. I think that's also interesting to see, for instance, versus MDMA assisted therapy, where there's more of a coaching or active role during. But yeah, really want to be able to help, or that's the people we're helping now that sort of fit within that model. So to someone that has enough resources that we can, after those integration sessions, we feel comfortable saying you're on your own now, and you hopefully be happy and have more direction in their life. And we're using the acceptance and commitment therapy framework, something you see a lot in academic literature too. And for people who don't know, I would say it's a third generation psychotherapy, sort of following in the footsteps of CBT, and then looking more at acceptance and looking more at your values. I think that's something we always do. So in the first or second session, that's something we really go deep on. Like, what are your values, and how can you live a life that's more in line with those values? Maybe that's really the thing that we ask and try to answer over the weeks that we're coaching someone.
That's awesome. Yeah, I was actually going to ask you, Floris, around the model that you use, but also how do you feel like all of this research that you're surrounded by and absorbing, and best practices and standards, how do you integrate that into your work, or how do you think that in a sense is infused through you and how you relate to people when you're coaching them?
Yeah, I think a part of it is that I can speak to the researcher, like what is happening with psychedelics and how does it impact a person. Like I think be able to speak to that more than the average coach or the average facilitator, of like, what have we seen there, what are some effects, and for which population has it worked, what happens in the brain, to go through that, to really give them a bit of an understanding of like how do psychedelics work themselves, to maybe have a little bit less of woo or mysticism around that part. But at the same time, it's limited what you can take from the research itself without actually taking it into practice. So I think you learn a lot more from actually facilitating people and learning yourself experience, right? Like having the coachee be someone that teaches you how to be a good coach, how to be a good listener. I think you can, in a way, learn more from that than from just sitting behind a computer and reading an academic article. So hopefully there's some synergy between both of them, but I think it's the real life, seeing what happens with people and seeing how you can support them. That's the where the real goal is, so to say.
Nice. And for a final question, having such a good handle on the research and knowing the industry so well, I'd love you to put on a bit of a prophetic hat, so to prophesy the future. And listeners and viewers, definitely, don't take this as 100%. This is definitely going to happen, because no one knows that. We are all a part of this, unknown reality that we're trying to build, and there's going to be many different pathways that need to evolve, really in unison together, hopefully with less conflict. So, having said that, I'm really interested to hear, if we were going to prophesy, if we were going to predict what's going to happen, how do you sense the psychedelic industry, the emergence of psychedelics in our culture globally, could impact the evolution of humanity and society, maybe decades ahead? And obviously no one knows this, but do you have any hopes for this as you are seeing this resurgence of psychedelics in our culture now? What ultimately might be some of the in a sense, the meta outcomes and causality that we see coming through our societies in decades to come?
This is a very large, expensive question maybe to end on, but I would say it's yeah, I would say that the world is becoming more psychedelic. If you even look at how many people are using psychedelics versus the 60s and 70s, I think the number it's a larger number right now than back then. And I think back then it was early, like it was exemplary of the counterculture, and now psychedelics are becoming part of the culture. So you see that sort of in more in media. And a friend of mine, Alexandra Plesner, she's working on psychedelics design, and she's sort of mapping it out and seeing like, oh, you see more psychedelic inspired design elements in big brands that are, yeah. So you see that more being integrated more. And if you look at the state level in the US, you see things changing there. I think psychedelics become more accepted, and still there needs to be good safeguards and good guidance around it to go well. But yeah, you see it becoming something that's more and more accepted, and something that more people have access to in a safe way. Even set and setting is something that's sort of not invented at the start of the 60s, but more towards the end, right? Really thinking like do this in a place that's responsible, that you, yeah, can do it without being overwhelmed, and yeah, think about the dose. And so I think that way we see it become something that's available to more and more people, both at the recreational level or at the level where people can do it to learn from it themselves without really entering the medical model. And of course, you see it, you've seen it over thousands of years in more of a religious context of sort of, yeah, psychedelics being used in that way. And I think that will continue, and you see that maybe becoming something that's larger than it is right now. And yeah, then there might, this is more of a hope, right, not a prophecy, of it becoming part of the medical system. So say in 10, 20 years, that is something that people can have as an option, that psychedelics are something that if the person themselves, like, yeah, is open to it, like they do need to do the work, right? I think that's what we do like to say within psychedelics. You can just sit back and let the ibuprofen do the work for you. You have to be involved. But for people who want to do that, that this is an option for them, and hopefully an option that is available not as the final option, as something that's you first have to do other treatments, but maybe the second option after you've done a bit of talk therapy, that you can say like, let's see if we can introduce psychedelics to this, and help you see things from a different perspective, and that being helpful. I think that's the why I would compare psychedelics against the classical antidepressants, SSRIs, that psychedelics have a more curative perspective, so that we can see that people come out at the other end and they are themselves before the trauma took place or before they had the depression. And yeah, psychedelics are just a part of that answer. I think we as people, we're less connected than we were before, and we're just scrolling on our phone, and those things we also have to think about. But I think psychedelics can be a catalyst, right? It's something that we can say that because of a psychedelic experience, someone becomes more engaged with their environment, and there's more thriving afterwards than before. So I'm not saying just be there in 5 years or 10 years, or exactly who's going to do it and how much therapy will be there. But I do see the medical part of it be something that, yeah, is in the mix in some years.
Yeah, that was a great answer to that expansive question. Thanks, Floris. So yeah, medical is definitely part of it. There's a piece here that's individual, kind of being having that self awareness to know when the right time is, or to have that option available, how psychedelics could help. And then on a collective level as well, that we're evolving a little bit more with our understanding of, I would hope as well, more with a spiritual sense as well, and a more of a kind of collective consciousness, appreciating nature and life itself a little bit more, and having less stress, and values oriented as well, that going through a bit of an evolution. Beautiful. Before we say goodbye, Floris, tell folks, yeah, how they can find out more about you. I know you've got quite a few websites, and you're doing quite a few projects. So just tell folks, yeah, where to find out more, and if they wanted to reach out, how would they get in touch with you?
Yeah, so the best way to find what I'm doing is to go to blossomanalysis.com. So that's where the research database is, and also some of the other related databases, for instance, on the trials or courses on psychedelics. There you can find my contact information too. And I would like to also say that the information I put on Blossom, I would say that about 90% of the information is available for free. So you can browse the website and look at all the different research papers. And then a full summary, that's something I do make for paying members. But to get the newsletter, to know what's going on, to see overviews of what we know about psychedelics. Like, some, we haven't really talked about it, but they have topic pages on the different psychedelics, on the different indications, that sort of synthesized information. Some are a bit outdated, so don't look too closely at all of them, but generally they should represent what the research says in a relatively good way. Then yeah, say if you're working with psychedelics in a medical context and you're working on that, then I would definitely do say to check out delphi-circle.com for consultancy in that regard. And there's a great team that's working with me, and because I'm the only by happenstance or by the work I've been doing the only European there. Like the rest is in the US, where still more is happening than here in Europe, or these things are happening a bit faster. And then finally, you can do if you are in Europe or you want to come here, sort of within that unique framework that we have here in the Netherlands, you want to experience coaching with psychedelics, then I would say to check out flowcoaching.nl, and then hopefully it will take you to our English version of the website immediately. But yeah, there check out what we're doing and see if that's fit for you. And then yeah, my wife she's gonna do this full time starting next week, so she'll be a bit more available than me. As you heard, I'm working on a few different things, but yeah, she's just a great therapist, so I can say it about her, I think. Um, and yeah, maybe even if you're just thinking about psychedelics and coaching or what's happening now, it's just shoot me a message. Like I should know most of the people that are working in the field. So even if it isn't a fit for you, just send a message anyway, and I'll refer you to someone else.
Thank you, Floris. And I want to send a big thank you to you for all the work you've done over the years at doing a job that no one else is really doing, especially doing it for free. 90% of your work you're saying. So thank you. You have made psychedelic science and research more accessible to people. And we're talking about accessibility, making it affordable, but you're making it more accessible to folks around the world to get access to the research, to the best practices, building community around that. And yeah, Blossom Analysis is an amazing resource. It's incredible what you've built there, pretty much single-handedly. So thank you. I really appreciate it. And yeah, it has a big impact in the world. So awesome work there.
Yeah, David, thank you so much.
Yeah. All right. Thank you, everybody, for listening to Psychedelics today. This has been a really good chat, Floris, and we'll have you back because there's always so much happening. So thanks so much for now.
Yeah, thank you, David.